essentially when we enroll folks in a program, this is the life of a program enrollment, to kind of give everybody an understanding of what happens on like a timeline. So at the very beginning, we have the start of an enrollment. We are creating or completing the enrollment screen. We are providing a service, because an enrollment is not a service in of itself. And then if you're an outreach, path, or RI project, then you'll need to also create a current living assessment. And then for permanent housing projects, as we go through, what you'll see is we have the little yellow dots are signifying we're providing services along the timeline. The blue dots is signifying the current living situation. So these are usually paired together for these program types. And then as time happens, we can have status assessments. And what a status assessment is essentially we are recording a change to any one of the data elements that was recorded at program enrollment. So those benchmark things like disabling conditions or income, health insurance, non-cash benefits, education, all those things. And you're going to see that when we complete the enrollment screen. And then as we're going along, if a client has been in our program for a year or more, we need to complete an annual assessment. And so typically when we're completing status and annual assessments, we're usually providing a service at the same time. So that's when we would record these. And as we continue through the program life, at the very end, we have a program exit, and there may be times where there are services provided and other times where there are not. So just wanted to kind of give you an idea of how this looks. You'll also notice that I have a move-in date here. This is for permanent housing projects. This is any permanent housing project, whether it's PSH for permanent supportive housing, housing with services, housing only, or even rapid rehousing. Typically you have a enrollment date, and then you'll have a move-in date after that. Occasionally you may see the enrollment date and the move-in date be the same, but not very often. The other thing that's not on here is for those night-by-night shelters or outreach programs. They have an additional data element called date of engagement. And what that means is when you start working with folks in those programs, essentially you're providing, you're usually building some rapport before you're actually getting to the meat of your work. So the moment you start providing services to help resolve their housing crisis, like helping them with IDs or connecting them to employment services or connecting them to other services to help resolve their housing crisis. Once you start doing those services, you now have a date of engagement. So typically the date of engagement is something that happens after you start your program enrollment. So when do you enroll folks for outreach? The date you first make contact with your client. For emergency shelters, whether it's entry exit or night by night, the E/E stands for entry exit. The NBN is night by night. So the night the client first stayed in the shelter is when you should be beginning your program enrollment. For transitional housing, the date the client moves into the residential project is when you should complete your enrollment. For permanent housing projects, again, this is permanent housing, housing with services, housing only, and rapid rehousing. The moment you need to enroll them is when you've admitted them into the project, meaning that you've completed an intake meeting with them and they meet the criteria for admission into your program. They want to be housed through your program, and they are able to access services and housing through your program. That's when you want to enroll them. The move-in date would be the day they actually move into a unit, receive the keys to their unit. And then for other service projects, you want to enroll them on the day that you first begin working with them and that they are receiving their first service. So now what we want to do while we're enrolling them is I'm starting on my adult client and I want to enroll them in my project. So I'm going to pick emergency shelter just for the sake of enrollment, and I'll show you other enrollments as well. So we're going to go to programs, which is just underneath the client name at the top left. And then I'm going to scroll down and I'm going to go to the entry exit emergency shelter. I'm going to select my drop down. And then when I scroll down, it's going to give me some information about the inventory in the program. And then on the left side near the bottom, it says include group members. So this is when you have the opportunity to enroll folks from the global household with your adult. So you should always start with the first person that you've identified as the head of household for the program enrollment. I get this question a lot of who should be the head of household. What I would tell you is the person that makes the entire household eligible should be your head of household, so long as they're the adult. For today's training, I'm going to just select the kid for now because I want to show you how to add a second person or additional people after they've already been enrolled, after the enrollment has already begun. So what I'm going to do is I'm going to toggle on this. So this selects my kid, and then I'm going to click enroll. So once I'm here, again, we need to fill out all fields in order to be able to save. So we have name of case manager / housing specialist. The reason for this is sometimes some programs have data entry folks and their direct service staff are not actually entering into HMIS. So what we'll want to do is go ahead and select a name. So I'm going to put myself here. It's going to ask the relationship to the head of household. Well, we're starting with our head of household, so it is a self. These are automatically generated through the computer, so you typically don't need to edit these. And then it's going to ask for the reason for homelessness. And then the type of residence, where did the client sleep last night? Being that I'm using an emergency shelter as my example, technically tonight they'd be sleeping in the emergency shelter. That's why it's asking where did they sleep last night. If you are a street outreach project, a supportive services project, or even a permanent housing project that does not yet have the unit available, where the client slept last night is most likely going to be the same place they're going to be sleeping tonight. And so on this drop down, you can see we have quite a few things here, everything from place not meant for human habitation, emergency shelters, long-term hospitals, jail, psychiatric hospitals. Just be sure to read through these so you're familiar with all the various options. And then it's length of stay in prior living situation. What we're talking about is how long were they living in this situation here. So I'm going to say that they've been in a place not meant for human habitation for more than a month but less than 90 days ago. And then it's going to ask the approximate date this episode of homelessness started. What we're referring to is the episode, meaning when they became literally homeless, either in a place not meant for human habitation or an emergency shelter. And so I'm going to say it's been more than a month but less than 90 days. So I'm just going to pick a date in February. But again, we want to actually ask our clients. If they're not sure of the date, then what we can do is we can talk to them about getting a ballpark. If it was last month, then we can ask, well, is it the beginning of the month, middle of the month, end of the month? If it was last year, but they're not really sure, we could always give benchmark dates or events like, was it around 4th of July? Was it around when school started? We can use ballparks here as well. This is really about trying to determine if they're chronically homeless by HUD's definition. Then the next question is total number of times on the streets or in an emergency shelter in the past 3 years. We're talking about specific episodes where they were literally homeless in a place not meant for human habitation or an emergency shelter. Again, this is about determining if they are chronically homeless. I'm just going to say 1 time, but if just so you can see, if I say 4 or more times, then we usually get additional logic that'll ask how many months total. So this question is just that, how many total number of months on the streets or in the emergency shelter in the past 3 years. The next questions are about disabling conditions and barriers. And so we have for general health, excellent, very good, fair, poor, and then we have our standard 3 of the doesn't know, refuse, and data not collected. And then for here, if we say yes to something, then it's going to ask if they're receiving services. And in many cases, for example, chronic health condition, if I said yes here, it's going to ask us if that condition is expected to be of long continued and indefinite duration and substantially impair their ability to live independently. For training today, I want to show what happens if things change here. So I'm going to put no's for everything right now. HIV and developmental disability is the only time if you say yes and you don't get the additional question of is it expected to be long-term, because these two conditions, by nature of what they are, it is expected that it'll be long-term and that it'll impair your ability to live independently. This question here, disabling condition, this should be answered yes if the client has any of the conditions above marked yes, or if they're receiving SSI, SSDI, or a VA disability. This question here only lives on the enrollment screen, and when we get to the status and annual assessment, if we change anything on those disabling conditions, we'll need to come back to this enrollment screen and edit this. So I want to be sure to show you that. Right now we're just going to mark it as no. It asks about if they're a domestic violence survivor. If we say yes, it asks about the last occurrence and if they're currently fleeing. It then asks about their cash income. This is all monthly benefits. So if I say yes, it then has all of these that we can toggle on or leave off. When it's light gray, it's off. When we toggle it on, then that is their income. So if we want to say that this person is receiving unemployment insurance, and let's say they're receiving $750 per month. When we get down to the next section, this will total it for us. And then it's going to ask about non-cash benefits. If I say yes, it's going to ask about SNAP, food stamps, or CalFresh, WIC, TANF, child care services, transportation, and other benefits. I'm going to say they're getting food stamps. And then the next section is about their health insurance. So if we say yes, they have health insurance, Medicaid or Medi-Cal, Medicare. This here where it says do not use, when you see things like this in HMIS where it says do not use or retired, please do not use it. Unfortunately, this is a field that at one point was an active field and had been used, and therefore there is data associated with it. So therefore we cannot delete it. It has to remain in the system. So the only option we have is the do not use. And for here, I'm just going to say other, and maybe and then it's going to ask about employment status. And if we say no, it's going to ask if they're seeking employment. If we say yes here, but we can also up here, if we say yes, they're employed, then it's going to ask what is the tenure, permanent, temporary, seasonal. And if we say permanent, it'll also ask how many hours did they work last week. I'm going to say no to this because my person is receiving unemployment benefits. And yes, they're seeking work. And then it's going to ask about their education and is the client currently enrolled in school? And then it's going to ask about the highest level of education completed. If I say high school diploma, it's going to ask if they have any other degrees. And when I'm all done, I'm going to hit save and next. So before I hit save and next, what I want to show you is we are enrolling this program for TINA Test 2 Test Adult. And when we clicked on enrolling our folks, we had toggled on the kid as well. What I would also like to show you is if I put this back to select so I haven't answered that, if I hit save and next, what you'll see is I have this changes have not been saved. Please correct your entry and try again. So if I go back, here's the one where I don't have anything marked off. So once I complete the field and hit save and next, as long as everything has been completed, what I should get is your changes have been saved successfully. And now the top is changed to say enroll program for client Tina 2 test kid. So now I'm answering all of these questions for the kid. And depending on how many folks you enroll in your programs, depends on how many enrollment screens you're going to need to go through. You will be completing an enrollment screen for each person you are enrolling in the program. So now it's asking me the relationship to the head of household. So this is their child. And it's going to ask for pregnancy status, disabling conditions. Again, kids can have disabling conditions as well as adults. That's why they ask this. I'm going to go ahead and just say no for simplicity's sake for today's training, since I've already showed you how the drop-down logic works. Health insurance, I'm going to say no for here. My child is not employed and they're not looking for work. And then my kid was 15, so they should be enrolled in school. And I'm going to say that they've completed 10th grade. And then it asks for the name of the school. For today's training, I'm just going to say public school. And then it'll ask the type here. So we have public, private, doesn't know. And then is the child connected to a homeless liaison? So this is somebody through the school district. If they don't know if they're connected, then the answer is most likely a no. And when I'm all done, I'm going to hit save and close. And so what has happened now is I'm back under my adult record because that's where I started. You'll see that I now have my program name that I've enrolled them in. Here's my enrollment. There's history, but it's dumped me into provide services because again, a program enrollment is not a service. You have to actually provide a service at enrollment. Then we have assessments, notes, files, and forms. You'll see over here on the right-hand side, we have our program type is a group. There are 2 members here. Our days in the program are 0 because we just enrolled them. Here is my assigned staff. When I click on the edit button, it is not a private program enrollment. And if I wanted to change the staff person they're assigned to, as long as they're an active HMIS user within the agency, I can change it to those folks. And then you'll see that my head of household is my adult. But if it had said my kid, I can change it here. And this is where we do see a lot of common errors in HMIS. So if we see that there's a kid as the head of household, we do want to correct it. So to correct it, you hit the edit button and you just select their member types for the household and hit save changes. The other thing you'll see here is the program group members. So here's my kid. They have the same start date as my parent and my kid is active. And I have no status assessments. And right now my notification is turned on. So that way when their annual assessment is due, I will get an email. The next thing I want to show you is adding another person into an existing enrollment. And when do we do this? We do this whenever we've begun a program enrollment and maybe forgot to toggle somebody on, so therefore we need to add their other members. Or as I said, maybe this is a person regaining custody of their kids or a partner or other family member joining the household in the program enrollment. So you want to start with your head of household. You want to be in the program enrollment that you're going to be adding someone into. And then on the right-hand side, you'll see where we have the program group members. So long as there are other members in their global household, we should get an add button. If there is no add button here, what it would tell me is either there are no other members in their global household, or the members that are in the global household already have an existing enrollment in this program, and therefore they can't be added into 2 program enrollments at the same time in the same program. So that would be, which does happen. A common error is a staff person will enroll a parent, then they'll go to the client record and enroll the kid, and I then have 2 individual program enrollments when it should be 1 joined group 1. If in your work you make that error, it is something I can fix, but you do need to email me at the HMIS at SAC Steps Forward email. So I want to add my last global household member. So I'm going to click on the add button here. And here is the last person that's part of the global household. I want to toggle them on and hit enroll. And now I have my enrollment screen for that person, and it'll default it to the current date, not necessarily the date of the program enrollment of the head of household. So if you had made the error, make sure that you're putting the right date. If you're enrolling them on the day that they are actually starting the program because they're joining the household, then the current date would be fine. And I'm going to say this was a roommate, if you remember. So I'm going to say their other non-relation member, and then it's going to ask all of this information about them as well. And so I'm just going to fill out these questions really quickly. And I'm going to say they're in reasonably good health. And I'm going to say that they're earning $900 a month. And they don't have non-cash benefits. They don't have health insurance. Yes, they are employed. I'm going to say that it is temporary and they only worked 20 hours last week. They're not enrolled and they got their GED and nothing else, and hit save and close. And now when we're in the program enrollment, you're going to see I'm still under my TINA 2 test adult, but here's my kid and here's the other parent.